Earache or ear pain is a common symptom, and it is not usually a sign of anything serious. Earache is more common in children due to childhood infections. It usually resolves within 7 days without requiring treatment. Young children may not be able to communicate their symptoms well, and they might indicate earache by rubbing or pulling their ears, not responding to some sounds, having high temperature, and being irritable and off their food. There are several causes of earache, and one of the most common causes is ear infections, particularly in children. Treatment is not always required for ear infections as they are caused by viruses, and they often get better on their own within 3 to 5 days. Ear infections can present with an earache, a high temperature, hearing loss, discharge from the affected ear, or feeling of pressure inside the ear. Ear infections that do not resolve on their own within 5 days may be treated with antibiotic tablets or eardrops, or antifungal or steroid eardrops. The other common cause of earache is sore throat or tonsillitis, which is infection of the tonsils. Sore throat or tonsillitis is usually caused by viral infections, and they usually resolve on their own within 7 to 10 days. Paracetamol can be considered if there is significant pain. Warm drinks with lemon and honey can also soothe the pain. More severe cases are treated with a course of oral antibiotics. Glue ear in children is a common cause of earache. Glue ear occurs when the middle part of the ear canal is filled up with fluid due to recurrent ear infections or allergies. This usually clears up within 3 months. The common symptoms are earache, temporary hearing loss, ringing or tinnitus in ears, and balance problems. Although it is less common, adults can also get glue ear and present with similar symptoms. Treatment is not always required for glue ear. More severe or recurrent cases may require a specialist assessment to consider insertion of grommets or small tubes implanted in the ear, or rarely surgery to remove the adenoids at the back of the nose. A benign and common cause of earache is buildup of earwax in one or both ears. Earwax usually falls out of ears on its own, but sometimes it can cause ear pain, hearing loss, tinnitus or dizziness. This can be treated with olive oil from a pharmacy or various eardrops designed to remove earwax. More resistant cases may require microsuction procedure to suck the wax out. It should be noted that teething in children and dental abscess in adults can also cause ear pain. There are several measures that can be taken to help with earache. Placing a warm or cold flannel on the ear can help reduce the earache. For more severe pain in ears, a painkiller like paracetamol can be considered. It is not recommended to put cotton buds or anything similar inside the ears, to try to remove the earwax, or to use water jet inside the ears. It is advisable to see a doctor for further assessment if there are symptoms such as discharge or bleeding from the ears, hearing loss, swelling around the ears, high temperature, feeling of something stuck in the ear, history of injury, if earache lasts more than 3 days, or if feeling unwell with earache. Please note that this is strictly for educational purposes and is not intended for a formal diagnosis or treatment in any way. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Images and animations in this video are only for illustrative purposes.